Okay. All right. Welcome everyone to the 17th episode of this SFU Sports Analytics virtual seminar series. Today, it's our privilege to have Dr. Matt Jordan from the Canadian Sport Institute Calgary to speak to us today about monitoring the return to sport transition after ACL or anterior cruciate ligament injury, from case study to prospective study. Dr. Matt Jordan is a performance consultant to elite athletes and has served athletes competing in the past 6 Olympic Winter Games. Dr. Jordan holds a Master of Science in Exercise and Neuromuscular Physiology from the University of Calgary and a PhD in Medical Science from the University of Calgary and University of Southern Denmark. He is currently the Director of Sports Science at the Canadian Sport Institute Calgary and an adjunct professor in the Faculty of Kinesiology at the University of Calgary and in the School of Medical and Health Sciences at Edith Cowan University in Perth, Australia. His research focuses on neuromuscular adaptations to resistance training and knee injury, re-injury prevention. Matt is also an esteemed alumnus, of Brookfield High School in Ottawa, where I attended as well, and we overlapped for a couple of years. So there was a few people from that era that ended up in high performance sports, so it's kind of an interesting story that I like to tell. All right, as for the talk today, the focus of his research program at the Canadian Sport Institute Calgary is to develop improved testing methods and data-driven recovery models to support the return of Canadian winter slope sport athletes with anterior cruciate ligament injuries to pre-injury performance levels. In this presentation, he will cover neuromuscular testing techniques they employ to evaluate athletes after ACL injury and a data-driven approach for forecasting post-injury recovery. Time permitting, he will also discuss some of their research initiatives around the application of wearable technology to help them monitor their return to sport transition after ACL injury. And with that, I will turn it over to Dr. Jordan, and I'll ask you just to share your screen, and I'm going to stop sharing mine and turn off my video.
Sounds good. Thank you. Desktop 2, share. Well, it's great to be here. Just do a quick little AV check here. I'm assuming everyone can see my screen and they can actually see it in the presenter view, or not presenter view, but the presentation mode.
Yeah, looks great.
Awesome, thanks. So appreciate it. It's great to be here. Proud to be alongside Dave. Crazy that we both went to the same high school, along as he said, with a couple other people from the high performance sport community. The focus of my talk today is just sharing some of the work that we're doing at the Canadian Sport Institute Calgary and through the Human Performance Lab at U of C around monitoring alpine skiers after ACL injury to help improve outcomes for them. I wanted to just take a second and acknowledge some of the individuals, my colleagues, my collaborators, our students, people that are helping me achieve the outcomes here today in this presentation. And without them, obviously, I cannot do this solo here. So a big thank you to all of them for their assistance. So I've got 5 stopping points, and I know time is of the essence here, and I'm going to try and make sure that I kind of flow through this. But the 5 stopping points are to talk about a little bit about ACL injury in alpine skiing, talk about this idea of time versus functional milestone, one of the techniques that we use at our institute called vertical jump force time asymmetry testing, and then we'll end talking a little bit about how we're using this to forecast recovery after ACL injury. A lot of the work that I'll be showing here done in the Strength and Power Lab at the Canadian Sport Institute Calgary. As you guys know, probably it's one of 4 Olympic training centers in Canada. And we've got a program, it's a research / public offering called the R2P code. R2P stands for return to performance. And the R2P code is meant to be sort of merging research and practitioners to help not only our sport, high performance sport athletes, but also people from the community. And just kind of quickly about our research program, generally globally, it's kind of looking at neuromuscular adaptations to resistance training. But we're around ACL injury, I'd say that we're kind of number 1, trying to develop better testing methodologies to pinpoint trainable deficits. Then using our test to forecast recovery after injury to guide that process of getting back to health, sport, and then performance. And then ultimately, obviously, to take this type of testing that we're doing to improve how we help athletes retrain and rehabilitate after an injury. So that's our program. So let's just start off with why this matters. I'm a horrible skier. I have no business being on a World Cup downhill course. I can tell you that the few times I've stood at the top of an alpine ski racing hill, icy World Cup downhill course. I'll tell you, it's one of the most terrifying things that I've ever done in my life. It's amazing what these athletes do. Consequent to this, this very high risk sport, there's traumatic injuries are a big part of the game. The knee is the most commonly injured body part, and the most common diagnosis, the most specific diagnosis, is an ACL tear. Interesting note, you may notice here that whereas in a lot of other circumstances, we talk about the risk for female athletes being 4 to 6 times greater than male athletes for an ACL injury, at the elite level in alpine skiing, there's actually no statistical difference between females and males in terms of the occurrence of knee injuries and ACL tears. So, seems pretty benign. You talk about an ACL tear and you talk to skiers, they sort of make it seem like it's getting their wisdom teeth pulled, rite of passage, happens to everybody. But what we know is these injuries are severe, and these injuries often happen like the video you're seeing on the screen. Skiers just 120, 30 kilometers an hour launching into the air and landing with a catastrophic injury. And this is kind of the point here, is that our research shows that these injuries are far from just, a trivial little ACL tear. And anyone who's had an ACL tear, that's not trivial at all. But when we talk about knee injuries in ski racing, these are big injuries. And we're talking about, massive trauma to the knee joint, high fraction of multi-ligament injuries, high fraction of bony articular cartilage injuries, particularly to the lateral compartment of the knee. And very often these injuries are tied in with complex meniscal tears. So you can see here, this is a study that we did where we went back retrospectively to look at concurrent injury with ACL tear in skiers. And yeah, just the take-home message is these athletes really, suffer a lot of damage. You'll see in a couple seconds too that there's also some unique things that we're trying to do to mitigate this. And one of them is going to be around this idea of looking at hamstring tendon autograft. So you may be surprised to know that you just reach back on behind your knee right now and feel onto that hamstring tendon, the semitendinosus tendon, which is on the back of your knee. When the surgeons reconstruct a torn ACL with this particular technique, they literally remove that hamstring tendon altogether from the patient to reconstruct a torn ACL. So a very high fraction of our athletes undergo this procedure, and as you'll see, this is something that we're trying to mitigate with our research. So here I just want to kind of quickly touch and bang home why this matters. This is a skier about 14 months post-surgery. It was part of our original cohort investigating how we could better identify these neuromuscular deficits in athletes with ACL injury. And what you see him doing is suffering a contralateral knee injury. So he is part of the statistic, the prevalence of ACL re-injury, where now he's basically suffered a contralateral knee injury after his left side ACL injury. Happened about 14 months post-surgery. And as the story goes, in our first cohort, at this time, we weren't really taking a data-driven approach. What we were doing was waiting for a certain amount of time to pass, maybe 9 months, making sure you're fit, you're strong, getting you back on the skis and hoping that everything goes well. And really our data just shows that there was an incredible number of athletes who went on to suffer re-injury. And so this is our regrettable case. And again, when we look at this from a statistical standpoint, we just know that, up to 20 to 40% of skiers will go on to eventually suffer another injury, which is, a major problem. And so that's why this stuff matters. And that's why we're undertaking the work that we're doing, is that our athletes are, at very high risk for another injury after that first one. And I'll be honest that even though that we know better, the fact of the matter is that, in a majority of cases, what we see is that practitioners are prone to just using time from surgery as their guide for when somebody's ready to get back to sport. Also want to make a mention about some of the testing batteries that are currently being used. This is an interesting study where they looked at 106 patients who had an ACL injury and an ACL reconstruction to look at common field tests, or let's just say clinic-based tests that we use to evaluate an individual after ACL injury to determine whether or not they're ready to get back to sport. And so I'll just have you highlight in on 2 columns. This column here where my cursor's hovering is the no re-injury group. So you're good to go. You don't suffer that second injury. And this one here is the group that does go on to suffer re-injury. And it's just really interesting to note in this study that the only thing that really differentiated the group that that didn't get hurt again from the group that did was quadriceps strength. So you can see that the limb symmetry index of about 84% in the group that did not go on to get hurt, compared to on average a limb symmetry index of 75%. And what I want to also have you look at are all these classic tests that we often use: single leg hop for distance, triple crossover hop, triple hop, 6-meter timed hop. And as you scan these limb symmetry indexes in this column where my cursor is, you may actually notice that the limb symmetry is actually a little bit lower in the group that fares better than the group that actually goes on to suffer injury. You can actually see in this instance here, the group that does go on to get hurt scores better, 94% on average with their limb symmetry index, compared to 91 for this classic test that often gets administered. So we got a challenge here, because these tests are the ones that people are using to clear athletes to determine whether they're ready, oftentimes, and it's better than probably just relying on time alone. But we have a bit of a gap here in terms of what are the things that really predict function after injury. Also like to just highlight a colleague, friend of mine, Enda King from the Sports Surgery Center in Dublin. He recently published the biggest study that I'm aware of that used 3D motion capture, a whole range of tests with good biomechanical evaluation. 1,400 individuals with ACL reconstruction to look at predictors for an eventual contralateral knee injury. Very interesting to note that no limb symmetry index across any of their measures really said much. In fact, what they found was that, number one, how you change direction was key. So people who went on to get hurt again, this case to the other knee, tended to change direction with certain mechanics that would put the ACL of the contralateral limb at greater risk for injury. And this is really interesting. So they used a drop jump, shown here in the silhouette, and this is a summary from their paper. And a drop jump is a short contact plyometric movement. You step off the box, you land on the ground, pretend like you're jumping off a hot plate, and you go for as max height as you can. Really interesting to note that the silhouette here, the faded silhouette, is actually the group that fared better, so they don't go on to get hurt again. And the dark silhouette is the ones who do. And all I could say is that just imagine you're driving a really nice, tight suspension Audi S4 versus an old squishy Cadillac. So the group that goes on to get hurt was more like the squishy Cadillac in terms of their suspension. They were less stiff, had longer ground contact times, decreased reactive strength index compared to the group that did not go on to get hurt. And so, and probably one of the largest studies that, I'm aware of, and really well done by the team at Sports Surgery's clinic in Dublin, really starts to indicate that we need better testing. We need to be thinking about more than just limb symmetry. We need to be thinking about more than just, definitely time from surgery, which most people usually just operate off of. And at the end of the day, some of these metrics that we often use in sport performance with more advanced biomechanical testing, like, drop jumping and using force plates to look at the kinetics and 3D motion capture to look at the kinematics, is crucial for being able to help evaluate athletes. So,
Hey, Matt,
this is, yes, I'll pause there.
If I just ask a question, so that's really fascinating stuff. Can you just describe in maybe a bit more detail the change of direction mechanic? Like what specifically were they looking at, and what were the deficits in terms of the change of direction measures?
Yeah, so I mean, it was I'm going off a bit of memory here. I've had him to present this so many times, and there's so much detail in there, right? I just don't want to jack it up and miss up the key pieces. But in general, Dave, what they did is an unplanned change of direction. So you're running along, light goes on, and you make a cut. And they found basically this tendency for kind of a more extended plant leg. So you're outside of your body center of mass, and it was actually whereas a lot of times when we talk about ACL injury, people often focus on the valgus loading or valgus knee collapse, so frontal plane mechanics. It was actually the sagittal plane mechanics that here were the most different between the two groups. So it's everything that was happening in the front to back, for people who aren't so much onto the anatomical planes, the sagittal plane. So basically they were outstretched more and creating more stress and strain on the ACL because of that mechanical change.
Okay, that's
And
really fascinating.
really, it really comes back to, like, it's like you got deficits at the knee joint. You've adapted to a new way of moving, and it's just this subtle change in how you move, right?
Yeah.
That was really the key.
So one more question. So
Yeah.
you talk a lot about contralateral injuries, and like maybe you'll get into this, but it's sort of counterintuitive, right? Like you'd think the weaker ACL, like the weakened or injured ACL, would be the one to get injured.
Yeah.
You may have already sort of mentioned this, but like, why is is it more common for the contralateral ligament to get injured, or is it just that it happens, enough that it's like what's going on there?
Well, I don't think we know for sure, Dave. Like, I think there's obviously a few factors. Like one are some papers, have looked at the graft type as being a potential culprit. So, and so the two graft types that are commonly used is this hamstring tendon autograft. So if you feel in the back of your knee and you feel that tendon that runs just down the inside of your thigh, it's a big, you'll feel it feels like a big rope.
Yeah.
They literally take that thing right out. It's shocking, when you think about what they do. But the other thing that they often will do is a second technique, which has a bit better. It fares a little better in terms of the failure rate. Is they'll take out the middle third of your patellar tendon, and they take out a little chunk of your patella and a little chunk of your tibia. So now you've basically got a hunk of tendon and two chunks of bone, right, that can now go into your tunnel, and that becomes your graft, and that heals a little bit stronger because of the bone-on-bone healing. But it's interesting to note that there's some associations there, Dave, about using that graft technique and a higher incidence of contralateral knee injury. There's definitely some indication that depending upon the type of graft you have different biomechanical dysfunction or asymmetries that might present. And then, some of the things that we're looking at in our lab is it sure seems to be the case that when you have this injury and you're compensating, so imagine you lose, let's just say 25% horsepower at the knee joint because you've got, all the things that transpire after an ACL reconstruction, more fibrotic quadriceps, loss of power, all those things. You start to move to more like a hip dominant strategy on that side. So you're kind of changing your mechanics. And the other thing too is that there's systematic loading of that non-injured limb. And so we've actually got some data looking at the effects of fatigue on the contralateral limb, showing that, interestingly enough, we'll measure these big asymmetries in jumping. And then as people get tired, their asymmetries actually get better. And you might be like, well, that's great. Like, is that because the the injured side is somehow doing more? And it's obviously not that. That's not the case. It's actually that the non-injured side is getting fatigued. So it does more work, and because of the way you compensate when you load. So whether or not there's, a factor there, is another piece of the puzzle that I think might be worth, in this obvious observation that other knee is more at risk a lot of times. Rehab too, sometimes, right? It's like, maybe you did more rehab on that side. You were more aware, you were more protective, who knows? Generally, most rehab protocols today, you end up doing as much on your non-injured limb as you're injured, but it's a key piece.
That's fascinating. Thanks for sharing those details.
Yeah, no, my pleasure. So just winding down our second stopping point here, and I just want to say that this is something that we shared in a Frontiers article, and we looked at monitoring the return to sport transition and skiing, and really as we dovetail out, the top part here is time from surgery, which is surprisingly still often used, right? It's like, well, you've been 8 to 9 months, the knee feels stable. How are you feeling? I feel pretty good, all right, well, let's give it a go. And, let's have a graduated, return back to snow. We have stories of skiers going from day 1 back on snow to day 10 with full competition runs. It's crazy, just to think about that crazy transition that you make. And so the words that we want to use are around this idea of, number one, time is important because it accounts for tissue healing, which is part of the puzzle, especially with some types of injury. But really what we want to focus on is this idea of milestones and being able to use a multifaceted approach to clearing the athlete. So it's not just medical, it's medical, psychological readiness. We use our physical therapy team and also our sport performance team to really do better appraisals of the athletes. And the last thing that you'll notice here as we move through our presentation is this idea of monitoring, right? It's not a final exam. And this is the problem, right? At 9 months post-surgery, you've been testing and training and doing all this stuff, and you go and you get your clearance from your doc. It's like, high five, you've passed the final exam and you're good to go. Congratulations, you've passed the course. You can head off and do your thing. But the actual recurrence of another injury is up to 24 months after that initial ACL reconstruction. So that really starts to suggest that what we need to be doing is monitoring the transitions back to health, back to sport, and back to performance. So these transition periods need to be characterized because you can have both progression and regression, right? As individuals make these transitions. So I think the challenge that we have though in the sport performance world is that, and that's why I'm just so amazed at what Enda and his crew did in Dublin. Like they really, like we're talking the full scale, full meal deal, 3D motion capture, unplanned change of directions, all of the testing. I mean, he said the protocols often took, let's say an hour to 90 minutes to accomplish. And for anybody who works in a sport performance setting with elite athletes, that, getting 90 minutes of their time is really tough, right? So as we were sort of evolving our practices here, one of the techniques that we began to use is this idea of a dual force plate system. And the dual force plate system is essentially, you're doing a vertical jump, we're getting the total vertical ground reaction force. And you can just think about it as the fraction that the right side and the left side is contributing to that total vertical ground reaction force. So, it's like, it's going to be affected for sure how you move, how you weight one side compared to the other, in terms of your capacities of your limb, in terms of how you're generating, ground reaction forces. But really this technique where we've got these two plates, one underneath the right, one underneath the left, we can now have this sort of practical test that we can really use now to monitor, right? So now it's like, hey, we can easily run athletes through this on a regular basis and sort of build our data-driven approach to decision-making. I'll just give you a quick view of how these look. This is the same athlete on the left. She's 4.5 months post-surgery. On the right, she's 7.5 months post-surgery. And I'll just pause her video here in a second to show you some of the things that you might find interesting. So there's our, pause that one. Kind of interesting to note. So 4.5 months post-surgery, you can clearly see the green lines above the blue line. So the blue line is reflecting her injured side. So there's an asymmetry present. You may also look a little more closely and say, oh, geez, like the shapes of the force time curves are actually different. So we've got a bimodal curve here with the green and a unimodal curve with the blue. So, really, if the ground reaction force is sort of this culmination of hip, knee, ankle, self-organization as the athlete is sort of like self-organizing to perform this vertical jump, you can see that there's almost a difference in strategy based on the shape of those force time curves. And we can also see as we move down to 7.5 months post-surgery that now the curves have normalized, right? So basically the blue is now up with the green, and we see that there's a similar shape in the curves between the two sides. So kind of a key point on our technique is you think about vertical jumping, and I think you probably are like, well, how high did that jump, right? 30 inches, 29 inches, what was my vert, right? But what we're using is we're not using the vertical jump here to like necessarily just look at how high did you jump. We're actually breaking down this curve so that we can look at various aspects of neuromuscular function. So what we use, very simply put, is we define some jump phases. So we solve for acceleration, forces mass times acceleration. We solve for acceleration, and then we integrate acceleration with respect to time to obtain what's called the velocity of the body center of mass. And this now allows us to define phases of interest in jumping. So here what you're seeing is the light shade of blue on the right panel, and the video is synced up there showing how this athlete is unloading. So, basically unloading and accelerating now down towards the earth. Phase 2 is what we call the eccentric deceleration phase, where you'll notice now that the athlete is, effectively, what I say is putting on the brakes. So essentially, they're literally, reversing the downward acceleration of their body center of mass, and that occurs from the minimum velocity to what I call the second zero crossing, which is this medium shade of blue here. And then in our final phase of movement, in the counter movement jump, is now we have what's called the concentric or propulsive phase. Here the athlete is coming up and off the force plates up into the air, and that's our dark shade of gray here, showing this propulsive phase. And at the end of the day, we've now got a way that we can go way underneath the hood of the vertical jump. And in addition to how high you jump, we can see how you unloaded, how you put on the brakes, and how you pushed off the ground to get yourself up in the air. And we've got now a really great way to get under the hood in terms of various neuromuscular capacities.
Hey Matt, I'm just going to interrupt quickly there because this is there's lots of good stuff here. So one question that came across the chat was, so if the athlete knows they're being measured, is there any chance that they might change their behavior?
They often try. Yeah, they often try. And that's certainly something we got to keep our eye on. And it's one of the reasons why those field tests of performance are so non-sensitive, let's just say, is that, when you got to make the same jump distance on right and left, you figure out a way to make that happen. So one of the things I'll say that is very important to control for is the effort level. So in our jump test, if you jump kind of medium hard versus maximal, you might see very different levels of functional asymmetry with the test. So that's one way people change their behavior. And certainly athletes try to kind of load more on one side. They often try to take a little bit longer to jump. There are a bunch of ways that they can compensate, but we can sort of start to uncover this. We're using high-speed video and IMU systems and force plates synchronously a lot of times when we're doing this testing. So we can usually, between one of those modalities, start to tease out when somebody's got something that they're hiding. It's a good question.
Gotcha. And then I've got how long does it take to do the full testing protocol from setup through having the athlete in and whatnot?
About 40 minutes for our full profile. But just for the jump testing, Dave, that we use for monitoring, we're done in 5 minutes.
And is that that's just the athlete time, or that's the entire flipping everything on and
yeah, it's pretty much the entire time. We usually add about another 20 to 30 minutes of data processing on the back end to kind of run the scripts and get the reports made.
Yeah.
For the jump testing. And the neuromuscular profile, when we do the full profile, it's a little bit more involved. Maybe another 20% in terms of time in the back end to run the reports. But it's far less, obviously the 3D motion capture is really where a lot more time gets involved. That's why we don't run that quite as often, and more in special circumstances, and we tend to use more of the IMU technology to sort of save on time.
Yeah.
Yeah, it's pretty efficient. We can get these done pretty quick.
Cool, thanks.
Yeah. So just as we kind of roll through, we're almost done this sort of third stopping point, but I just wanted to say that, there's a whole variety of metrics that you can pull from a vertical jump. And I think that that's kind of the interesting thing now. It's not just how high did you jump. One of the metrics that we're looking at as part of our assessment is impulse, which is the area underneath the force time curve. I've just moving my cursor over the area for the eccentric deceleration phase in light blue and the concentric propulsive phase in kind of the darker blue. We can also through this obtain a measure of jump height using the impulse momentum relationship. And the other thing that we can look at too, as I mentioned, back to Enda King's work, is this idea of reactive strength. So this is basically a ratio of how high did you jump relative to how fast did you jump. So when an athlete has become like a really cushy spring, their jump times tend to go down. So their contraction times, go up. Their contraction times go up. So they're spending more time on the ground, and their jump heights go down. So the ratio starts to come down. And when we've got, as Enda's work shows, the more Audi S4 type spring, you got short jump times and big jump heights, which gives you that big ratio for RSI. And that's, again, back to Enda's work, a very valuable metric for evaluating plyometric ability in athletes as they recover. So just kind of quickly as we transition out about some of the other tests that we're doing, our asymmetry index is there's lots of ways to look at this. It's very important that we maintain not only the magnitude of the asymmetry, but also the direction. Was it the right side or the left side that was more dominant? We calculate our asymmetry index with the equation you see on the screen, contralateral minus ACLR divided by max of left or right. And then we create a limb symmetry index whereby 0 means you're symmetrical, and a value of positive means your contralateral limb was more dominant, negative means your ACLR limb was more dominant. The last thing I just want to touch on as we transition to forecasting is another thing, quadricep and hamstring strength. So old school dynamometer testing. We do isometric testing, and just to give you a sense about some of the metrics that we look at, you'll notice here are 2 torque time curves for the knee extensors and the knee flexors. It can take 500 milliseconds, so half a second, for you to develop your maximum strength capacity in a movement of like a knee extension or flexion. Sometimes almost a second, right? So it's an eternity when you talk about sport performance or sport injury. What we know is the time frame for non-contact ACL injury is about 50 milliseconds. So we know that it's not just how strong you are, it's how you pre-activate muscles, and it's also how fast you make force. And that's another piece of the puzzle that we're looking at here, is not only how strong are you, but we're looking at a measure of what's called rate of force development. The strength capacity here is called explosive strength, but it's a measure of the slope of the force time curve or the torque time curve in specific time intervals related to an ACL injury. So altogether, this kind of frames up some of the testing that we're doing at our center. Stopping point 4 now, I just want to talk a little bit about how we're now using this from a forecasting standpoint, and I say from case study to perspective study. We published kind of in great detail, at least we tried to talk about all the different data points that we're obtaining from athletes with ACL injury. So, this is an example from our paper that shows the workloads of our case study athlete, measured as the sessional RPE method over almost her entire career. She tended to fade off a little bit with her logging in April when she was off season, but this athlete was just really good at sort of logging workouts, just using that simple sessional RPE method. And what we highlighted in the paper, it's not just looking at ham quad strength and, are you jumping well? We're also looking at, did you restore your physical work capacity, relative to where this athlete might have been in her previous years. So you can see, in the top panel here is her weekly training loads recorded over her career. Here's where she suffers her ACL injury. And what we highlighted in this particular paper was, number one, using a periodized approach to rehab. So not just, trucking through rehab. We take sport performance and we actually apply sport performance principles to rehab to be able to provide a periodized approach. And we talked about how, as she made her transition back on snow, one measure that we looked at was, had she restored her off snow work capacity to similar levels that we would have seen in previous years, as an indicator of her readiness for those transitions. So, this just sort of gives you that progression in load back to her return to snow and then up to her first race, where, she's now, moved on and she's well past this 18-month time point now. But
hey, Matt.
Yeah.
Can you just talk briefly about how you quantified training load in this particular study?
Yeah, absolutely. So very simply put, is we have a survey questionnaire that we administer where we ask, how long the training session was in minutes, how hard on a scale from 1 to 10, 10 being as hard as possible, maximal effort exercise, and then the type. So this could be, strength, energy system training, on snow work, rehab, whatever. And then the last data point that we get here is, especially for rehab, is we look at a knee pain scale just to sort of mark and track subjective rating of knee pain. But the first 2 markers there are what comprise our training load. So it's basically how long did you train times how hard did you train, and then we bin it by what type of training you did as well.
And so these weekly training loads, is that a sum of all of the different time? Is it weighted, or is it just a straight up sum? Or
to say this is shown as a straight up sum of the total training load in that week.
Okay, got it. Thanks.
Yeah. And then, simply put, we got our training loads coming in. We've got our muscle strength and RFD testing. I've touched on 2 of the measures that we're looking at, jumping asymmetries and also our hamstring quadricep strength testing. We look at neuromuscular control using, IMUs to look at how people are moving, which, as Enda showed, was key. The performance fatigability testing, right? It's another big part of our assessments, oftentimes coupled with EMG. And then, getting more clinical measures, right? Pattern of combined injury, looking at, biological sex, age, and psychological readiness, putting this all into the soup and now able to use a bit more of a data-driven approach to forecast that post-injury recovery period. So Getting close to the end here, but I just wanted to say that this is where kind of the rubber hits the road for what we're trying to do is, I'll be honest, we're not, yes, we'd love to have the holy grail to know what are the predictors of re-injury, but the challenge we have in our environment is when we bring in data, we are actually making decisions real time on how to modify training to bring this athlete closer to their pre-injury performance level. So we've got all this pre-injury data, we've got all this post-injury data, and then our team is using this data to strategize on how to optimize the recovery period after injury. So we are not just testing and leaving this as, let's see what happens. We are actively using this information every single time we collect data. We're meeting as a team. We actually just had a meeting this morning, reviewed all of our injured athletes, data-led, opinions from practitioners come in second, and we're using this information to strategize on what we can do. But here's the important question. This videos represent two athletes. They are both 7.5 months post-surgery. The athlete on the left is a young development level athlete, and the athlete on the right is a senior elite athlete. You can clearly see, you don't need to be an expert on forced time curves and jumping, but you can clearly see that the shapes of those curves and the asymmetries that are present are drastically different between the two athletes. So even though they are both at the same time post-surgery, they are not both at the same level of physical readiness to get back to a high-risk activity. And here, what we want to do is to forecast injury recovery, because our hardest, most challenging thing that we have is trying to manage the uncertainty about when an athlete is sufficiently prepared to get back on snow, and how do you manage expectations with a coach, an athlete, a whole multidisciplinary team of practitioners where we're trying to work together and use data to drive discussion. And really, at the end of the day, think about the limb symmetry. You could have two very weak but symmetrical limbs, right? That would not be ideal. In fact, in his work, it was interesting that the groups that comparing the re-injury and the contralateral limb, both groups were asymmetrical. It was just that the group that did not go on to get hurt again had two strong limbs, and they were asymmetrical. So what we know is you can't just hinge this on one thing. You can't just hinge this on time. And we need to have better ways to model recovery so that when I sit down with a coach and an athlete and a team, we can say, here's where we see you tracking over time, and here's what we see in terms of your recovery rate as you return. So this is where the data science comes in, because we have been able to collect now just over 10 years of longitudinally collected data. We are collecting counter movement jumping, isometric knee extensor torque, as shown before, and knee flexor torque. And we've now at the stage where we've got 195 athletes who are non-injured. 31 athletes in our winter slope sports have had ACL injury, comprising about 3,500 measurements for our control group and 484 for our ACLR. And remember, a lot of these measurements are happening before injury, right? So we're actually getting a pre-injury baseline. And here what you're seeing is, as our models are growing, is we've got our first panel is our semitendinosis autograft group. Our second panel is the bone patellar tendon bone group. And our third panel here is our non-injured controls. For our ACLR athletes, which are these two panels, you'll see that we've broken it out from less than 180 days post-surgery, 181 to 270 post-surgery, up to a year post-surgery, and then a year or more, showing the mean asymmetry for jumping and for our knee extensor strength. It's the only two variables that I'm showing here, looking at rate of force development and maximal strength. But you can see how asymmetries are declining over time with our box plot, as the athletes make their recovery. You can also see a little bit of a difference in terms of the recovery rates for the two groups. We do not have a lot of data yet for bone patellar tendon bone, owing to the fact that the majority of our skiers get semitendinosus autograft. But now what we can do, and this is emerging, right? We still got more work to do, is we can use statistical modeling. So here, what I'm showing is a result of a generalized additive mixed model. We use R as our programming language for this. And essentially, we are looking to model the recovery of these asymmetry indexes according to your surgical technique as a function of time using a smooth term. And we're able to basically start to develop nonlinear models of recovery. And this has been where our efforts have been going. So that now when we sit down, what we really want to know is, when we sit down to look at an N=1 athlete, are you tracking on schedule, behind schedule, right? Or are you ahead of schedule, right, in terms of your recovery rate? So it's now becomes a data-informed decision-making discussion. and it's based off of our longitudinally collected data. This is a little bit of a work in progress. As I've said, we've got to really build up our database, especially around the different types of graphs, but that's ongoing work. But this just kind of shows you what this might look like. So these are the average recovery curves for the bone patellar tendon bone graft, which is that one where they take out that middle third of your patellar tendon, and our hamstring tendon, which is shown in red. But just looking at days from surgery, shown on the vertical, or sorry, the horizontal axis, and our asymmetry index for jumping and for our quad strength and whatnot. We've got them all into the soup, but we're showing here our concentric movement phase on the left panel and our eccentric deceleration phase on the right panel. And you can see, number one, the shapes of the curves are quite different. The recovery rates are different. And, really here now, the conversation becomes, if I've got an athlete with a severe multi-ligament injury, this is the red curve that you see here, and an athlete with a straightforward ACL tear, right, shown here in blue, where are they tracking relative to our average curve that is shown here in black? And now our conversations have gone from, being time-focused, subjective, right, opinion-based, to being led with data, and really asking the question, based on the testing that we're doing, how do we see you tracking as you make your recovery after this serious injury? And importantly, how are you recovering so that we can guide your transition back to these high-risk environments a little bit more effectively? So final stopping point, I just wanted to quickly touch on some of my future directions that, were our future directions at the Institute, but also some collaborations. And I thought I would highlight in on a local business that's just down the road from you guys. It's a company called Plantiga. Full disclosure, I am on their team as an advisor. So I do have a vested interest in the data that I'm showing you here, because it's been something that I do work for them in terms of helping them build this technology. So that's my bias. But nevertheless, when the CEO called me about 5-6 years ago to say, hey, I know you're doing all this work in the lab around optimizing recovery after injury. I'm working at building an insole, IMU powered insole, that could be used to look at asymmetries out in the real world, potentially where they matter most. What do you think? And I was like, well, absolutely. Like, that's the blind spot, is we do all this testing in the lab, and then an athlete goes overseas or wherever they're going to go, and they're off our radar. And now we're unable to really attend to them. And this is where wearable technology is absolutely brilliant. So I just want to showcase a little bit of this data. I think you might find it interesting, given this is a sport analytics group. Number one is the Plantiga system is just this flexible insole. It's got an IMU that is underneath the just about the kind of the arch, roughly, goes inside your shoe. And the one thing I would say is, having the IMU inside the shoe, it is a drastically different signal compared to putting an IMU on the body. My experience with body-borne IMUs on shins and lower backs is that the signal is quite noisy. It's actually hard to kind of pick up what's going on because of the artifacts that occur from just, being out there. But with this IMU and an insole inside a shoe, it's a beautifully clean signal. So that's kind of the first advantage of this particular approach. We have helped out Plantiga with some validation of their system, particularly looking at this reactive strength index, right? So going back to Enda's work, where he showed that the reactive strength index was probably one of the only things that really differentiated his group of people who didn't go on to get re-injury compared to those who did. The ones who go on to get hurt again are less stiff. They're like a squishy Cadillac suspension. And you'll notice here this little arrow says decreased reactive strength index. Well, you now know that's a measure of flight time over ground contact time. But if you don't have a force plate, and you don't have sort of a lab handy, you could potentially use the Plantiga system. So the important thing about Plantiga is they are using machine learning, deep learning techniques to be able to extract insights. So the promise with obviously an AI powered system is that it gets better with time and more data. That's kind of how that works, is it needs to learn, and that's what's happening. So here what you're seeing is the error in RSI from the first version of their AI. So this algorithm here was a analytical algorithm compared to their deep learning algorithm. So you can see the improvement compared to our force plate system. So our force plate was the gold standard, and the RSI from the insole was the comparative. And here you see the old version, the analytical algorithm, looking at the R squared between our force plate and the insole, and then the improvement now with the AI powered deep learning technique. This data collection, again, in your backyard, not mine, so some great partnerships with Lynn Valley Physio. They're deploying this here and using this to recover, to monitor recovery of patients with ACL-R. And this is an example of a recovery and reactive strength index and jump height in a female athlete with ACL injury, sort of tracking them over time, using the insoles as the measurement device. But just want to kind of wrap up here, final couple slides to talk about this idea of pattern recognition. And it's really interesting. Their CTO, Sean Ross has got a really great background. I think you guys would really appreciate him and your team here for sport analytics. But his background is with Anaconda and Tableau, as a brilliant guy. And when he saw these signals that were coming in from the IMUs, he's like, what we really need to use is we need to use deep learning to really extract insights around pattern recognition and whatnot. And so this is just kind of a quick touch point of their video of running synchronized with the IMU signal. And then when you look at the various tests they can do, one of them is this 2-minute walk test. And what happens when you plot your IMU signals against one another as you're doing this 2-minute walk test or a run test, but all of their pattern recognition for ACL-R has been based off a walk test. You do a 2-minute walk test, you plug in, whether you're ACL-R or not, you plug in how much time it's been from surgery as your anchor points. And then, essentially you get these beautiful IMU pictures of your movement quality. So basically how you're moving, we often call them the movement maps. So these are movement maps of an individual here showing a very hard impact on the right compared to normal gait. So it shows you how the picture of plotting what the right is doing while the left is moving, what the left is doing while the right is moving. So it's these phase maps. You can see these intricate pictures that sort of reflect, your kinetics and kinematics of a walk. They've got now they're using convolutional neural networks and recurrent neural networks, over 800 2-minute walk tests from ACL-R patients. And then they've now used this to start to look at the system's basically predicting whether or not your movement pattern looks like somebody who's hurt or not. So it's not predicting whether you're injured. It's looking at how you're moving to say, does that look like somebody who's moving, who's had an injury or not? So just final slide here. I just wanted to share this data with you, but it's a 5-point scale that they use. 5 means that your movement pattern looks a lot like somebody who's healthy, and a 1 means your movement pattern looks a lot like somebody who's had an ACL-R. And so some of the data that's come out of this is here, ACL-R patients doing a walk test at less than 50 days post-surgery. And this is unseen data. The algorithm predicted a score of 1. ACL-R patients more than 50 days post-surgery, the algo predicts a score of 2. And then you start to see some more common injuries. Here they applied it with knee overuse injuries. 20 days, less than 20 days post-injury predicts it at a 2.2. 3.9 for overuse injuries with more than 20 days post-injury. And then looking at post-surgical, looking at the contralateral limb, and then the scores for non-injured controls. So you can see that, this might be a way from a data analytics standpoint, optimizing the return to sport transition. We now have potentially wearable technologies that can help practitioners have better conversations and drive better insights around this process. That's my timer going off, telling me that I'm at 45 minutes. And it's perfect because it's my final slide. I just wanted to just kind of quickly recap that, stopping point number 1 is why this is so important. We have a very alarming attrition rate. So you hurt your knee once, the stories are not great. A high fraction of these athletes go on to hurt their knees again, and potentially more often the other knee. And so what we used to do was we rolled the dice, we looked at time from surgery, and we were not really evaluating neuromuscular function with tests that were sensitive enough to pick out deficits in our athletes. A lot of performance-based testing, which we know are not very sensitive at all. A lot of times just rolling the dice and being like, hey, knee feels good, I think you're good, let's give it a whirl. But that's where our work is coming in to develop these better tests, and highlighted our one technique that we're using is the dual force plate system, and using that to look at interlimb asymmetry. And then here at the end, I just wanted to share, where we're going from the single athlete, N=1 case study, where we're trying to optimize their return. But really the power of the N=1 person over time as we start to build this larger perspective data set, which we now can use with some neat little statistical modeling techniques like the generalized additive mix model, to be able to forecast recovery, which is hopefully going to help us drive better conversations with our team and hopefully lead to better outcomes for our athletes. So with that said, I just wanted to say a huge thank you to Dave. And obviously another shout out to my team up at the Canadian Sport Institute Calgary. I cannot do that without them. They're amazing. So to my students, to our team, to my mentors, people involved with the research, a huge thank you for everything you do. And with that, I will wrap it up. Thank you.
Great stuff. Thanks so much, Matt. I'm just going to turn my video on. So that was excellent. I mean, it's just such beautiful, beautifully presented and excellent data. So I'll open the floor to questions. There's a couple that were in the chat form, so I'll start with those. And so the first one is in the jump testing. You showed the counter movement and takeoff phases, but not the landing mechanics. Is there a reason for that, or is that something separate that and you didn't want to overload us, or what's going on with that?
Yeah, I think the short answer is that what we found with landing is kind of twofold. Number one, it's quite variable. So when we look at the landing kinetics, it's all over the place. And that's because you jump and you're in the air and you self-organize, and sometimes you hit with, we'll see non-injured athletes who hit with 50% more impulse on their right side, and then it's 50% more on the other side, and it's like you're trying to account for the fact that in the air you're having to like position yourself to make a sequence of movements that often are determined by how you took off the ground, and those are always it's quite variable. So the short answer is no, we're not using that in terms of jumping, but we are looking at jump landing or landings in general, single leg landings. And one of the things that we're doing as a research study is we're looking at the relationship between capacity, so muscle strength capacity at the hip and knee, and the way that influences the strategy that snowboarders and freestyle skiers use to land. So that is ongoing for us right now. But as far as the vertical jump, it's just super variable looking at those landings. So I think I need some help there from people like yourselves to strategize on how we could make better use of that data.
Cool. Another question I had was, so for the Plantiga insoles, I mean, is the idea that at some point you're going to have them in the ski boots and you're going to try to track them on snow?
Yeah, I mean, it's been on the radar to give that a whirl. Right now, the insoles are really suited for walking, running, and jumping. So that's where that's where the tests or the assessments that you can do are kind of further along. There is an open activity mode where you can collect data just openly, and that's been on the back of my head to throw a pair of insoles in the boots of an athlete and just have them ski and see what we can see in terms of left versus right difference. Haven't done that yet. It's been on the radar, and we just haven't had the right opportunity yet.
Okay, great. I'm just going to look through the chat form here. There's a few questions. If someone wants to just unmute and ask their question, please go ahead. So I think we've got Matthew. Do you want to just ask your question? And then I think Tom, maybe you have a question after Matt.
Yeah, great. Can you hear me okay?
Yep.
Awesome. Yeah, I had a question about the hamstring graft versus the patellar tendon graft. Like, what is that process like in terms of the selection of the surgery? Is that done by the doctor? Is that the athlete's choice, or how does that work?
It's usually the surgeon's surgeon preference. Certainly the patient would come into that too, in terms of, you know, what might be best suited, but often it's a calculus done by the surgeon themselves. You know, the reason that we have such a high proportion of skiers who get the hamstring tendon autograft is that, you know, again, this isn't data driven, it's more anecdotal, but anecdotally, the skiers who would get the bone patellar tendon bone grafts, what would end up happening is, just because skiing has got so much eccentric load, and such a high force environment that, and you know, you can imagine being in a ski boot, you're automatically into this kind of acute knee, you know, shin angle, right? Is that they ended up with these secondary patellofemoral pain syndromes and patellar tendinopathies that were just almost even more problematic than having a bit of a loose knee. So, you know, it was like, that was what was killing their careers. It wasn't that the ACL injury itself was the problem. It was that secondary comorbidity coming from the bone patellar tendon bone graft. So really, Matthew, just to say, it's like, it's up to the surgeon, but that, you know, they almost, I mean, I have not worked with an alpine skier from numerous countries now, you know, not just Canadians, but it's really quite common to have the hamstring tendon. The other technique that's more popular now is the quadricep tendon. So that's now you're taking tendinous tissue from above your kneecap. Yeah, it's a surgeon preference, and with skiers, it's almost exclusively hamstring tendon. But they all have their own comorbidities that they introduce, and it's certainly a factor.
Awesome, thank you.
Great. So Tim Swartz was asked, what sort of emphasis is there in terms of ACL injury prevention? So what you know, you get a skier who hasn't been injured, you know, what are we doing with them to help them not get injured in the first place?
Well, I mean, you know, there's less evidence at the highest elite level of the sport for in like traditional injury prevention training programs. So what's happening at the elite levels are things like changing course conditions, changing ski radius, you know, changing rules, those sorts of things, which have been introduced to try to mitigate the risk of knee injuries. Most of them have not really panned out, to be honest with you. Like the FIS had a really nice attempt at changing the ski radius to be able to help reduce that torquey, twisty loading on the knee, but it didn't have a, you know, it was an underpowered study because they just didn't have enough injuries to really sort of show an effect, but they weren't able to demonstrate a statistical effect there for reducing injury. What we know is in field sports, and in particularly in youth sports, I work a lot with Carolyn Emery's team over at the University of Calgary in the Sport Injury Prevention Research Center. What we know, and they've done phenomenal work here, is that injury prevention training programs can reduce the risk of sport injury by, you know, like conservatively, you know, 40%. So, you know, some studies show up to 70% reduction in sport injury, particularly around things like ACL injuries. And where we see this in youth alpine skiing is an increasing amount of work being done in this area, showing that there are some benefits of these ACL injury prevention programs. And what they focus on are neuromuscular control. So this would be like balance, landing capacity, those sorts of things. Hamstring strength, like that's been a very interesting finding from some of my friends in Switzerland looking at this, is the introduction of regular hamstring training throughout the season seemed to have has had a dramatic effect in reducing ACL injury rates in young skiers. And the other thing is symmetry. A study out of Austria looked at symmetry and leg press strength and found a correlation between increased asymmetry and injury risk. So ensuring that you got two strong legs, right? And that those two strong legs are both within, you know, 5% of each other appears to be the best way to help a skier out, where, you know, you've got bidirectional turns and you got to solve problems on your left leg and your right leg. So you need two strong legs, and obviously symmetry seems to be a factor there too.
Thanks, Matt. Hopefully that answers your question, Tim. I will follow up. So like, can you just describe like maybe a couple of example exercises for like landing capacity and hamstring strength? I mean, are they just doing Nordics? Is this kind of like translating a soccer program to skiing, or is it more specific than that?
Normally in our approach, we target the hamstrings in 3 ways. So usually a closed chain movement, which could be like a single leg Romanian deadlift, reverse hyper, even though it's not a closed chain, it's more of a hip extension oriented hamstring exercise. So usually something involving that hip extension function of the hamstring. And then the second thing is a really healthy amount of knee flexor oriented training. And so where our attention goes beyond the obvious stuff is, really if you think about ACL injury, it's the eccentric strength capacity of the hamstrings that are really critical for preventing that anterior translation of a tibia on a fixed femur. So we do a lot of tempo play, and tempo play meaning that when you prescribe a resistance training exercise, you prescribe a tempo for the eccentric movement phase and the concentric movement phase, and pauses in the movement. And so we'll do hamstring exercises at the knee joint where it might be raise up and then drop and catch, raise up, drop and catch. We might do accentuated eccentric tempos, so 5 or 6 second lowers on the way down. We also do one where we'll work on the hamstrings are kind of like, so they're a knee flexor, but they also steer the tibia internally and externally in terms of a rotational function. They're like little stirrups on your tibia. So if you can imagine that, we'll often do some isometric training. We'll put the athlete on a couple of benches. They're holding in a bridge position, like a single leg bridge. And then we might do rotational loading where we'll throw, let's say, a medicine ball at them. And they're now stabilizing, trying to create, good trunk stability and good stability through the hip, knee, and ankle, by using the hamstrings in that sort of synergistic role to be able to create torsional stability at the knee. So that's another example of a movement that we do. And honestly, the other thing is just really, it's not just very often when I see how people train hamstrings tend to be more of a type 2 muscle fiber in terms of its proportion. And, very often hamstring training will be like high rep, you'll 10, 15, 20 reps, you're on a Swiss ball and, ripping out, till you're blue in the face. We train the hamstrings for this explosive strength capacity, right? So this is now heavy, fast lifting. And so the best way to train explosive strength of the hamstrings is to do heavy, high voluntary effort contractions. So this would be anywhere from 5 to 8 RM repetition maximum loading with these various tempo plays that we would use. So those are some of the key strategies. Got to get on it though. And sorry, last little thing too. I didn't go into this too much detail. I wish I could have shown you some of the nice pictures from one of our grad students using extended field of view ultrasound to look at the impact of a hamstring tendon autograft on hamstring morphology. But what we find is that in a high fraction of skiers, 12 months post-surgery, there's still no neotendon coming back from that autograft, that hamstring tendon that's been removed. And so where we see the key being is after a hamstring tendon autograft, the consistency of hamstring training for up to 2-3 years post-surgery is absolutely essential. So this means you're hitting it 2 to 3 days a week forever, right? Until you really start to create the mechanical load and restore the tissue, not only the tissue morphology, but also strength.
Well, I'm glad I asked. That's really interesting stuff. Okay, I'm going to go back to the audience, and if you have a question, please unmute and ask away.
Hi, it's Peter.
Hi.
Hey, Matt. Thanks very much for that presentation. Every once in a while I see these things and I think this is really above my pay grade. There's a lot going on there, and really cool presentation. Thanks for doing that. I'm not sure to ask questions that are really intriguing for the group, but one thing that did catch my eye was this return to performance and how it was turned into a 3-stage process. I think it was healthy, and then it was healthy, and then there's 1 stage, and there's performance stage. Did I get that right?
Yeah.
Yeah. Is that a new thing, and where did that come from? And and how often is that used these days, or is that something old altogether?
It's becoming used more and more and more, Peter. And the reason is that as data has come out on ACL injury, ACL reconstruction, and sort of like what matters, right? a lot of times you're looking at the study stops at 9 months or 10 months. But what we're seeing is that in an athletic population, it's like 45 to 60% actually make it back to a pre-injury performance level. So it's really a high fraction of individuals that never really make it back, right, to where they were. Study just came out looking at this in NFL football players, looking at, so they used I think it was running backs and wide receivers, maybe, I think. But they just recently published looking at using the combine as an anchor point to look at speed and strength and all these things. And, same story there, right? And so you got all the bells and whistles that, in an NFL team, you would think. But, the majority of athletes who get the ACL injury are not back to where they were. So increasingly, the conversation has become more and more and more about, you get back to health, which is activities of daily living. I can walk without a limp. I've got full range of motion, which are all key for success. That's what we're starting with. Is you get your knee moves 180 degrees and you're walking normal and all that stuff looks great. You get back to sport 9 months, but then there's this transition point where now the highest risk for injury is 24 months after injury, right? And this impairment of getting back to your pre-injury performance level. So more and more and more people are talking about this long game about getting back to performance. Return to competition sometimes used return to performance, but so
yeah. All right, can I ask one more question, Dave? Do we have time?
Yeah, please.
Okay. So I was talking with trainers, this trainer the other day. He's a well thought out sort of person, but also professional trainer. And I'm asking, like, what sports do you keep your eye on in order to understand, like, where things are going or the gold standard? And he said, well, in his opinion, it was basketball and football. Like football, he mentioned, they're the most well funded, it seems like, at least in North America. And so that was a place to look for these innovations and gold standards and stuff. What sports do you think are some of the best, aside from the work that you guys are obviously doing, which is excellent, but where do you like to look to?
Yeah, and I might not to be a contrarian here, but I might challenge the notion of NFL, and I hope I'm not offending anybody here if you've got close ties to the NFL. But my experience has been, honestly,
this is a good place to be contrarian. We're happy to hear.
Yeah.
Contrary points of view. Please go ahead.
Yeah, flame away.
I've had the opportunity to look under the hood with a variety of NFL teams, and some certainly are doing an excellent job. So but it's not commonplace, and.
Yeah, it's uneven from team to team, even, right?
Yeah,
so I've done research.
So if I had to say where I would look, is Australian rules football in Australia is, they are now far along with this. And the other one too, and this is a recent study as well that just came out. And this is the thing, sorry to belabor this, the injury rates in NFL have not changed one iota. Past.
Wow.
Yeah,
unless
sign. There's new data that I'm unaware of, and you're like, oh, hey, wait, the study's coming out. All the studies I've seen recently on it is that if anything, it's worse. There's more injuries. There's more stuff happening. There's higher prevalences of ACL injuries and all this stuff going on. And one place I think it might be also interesting to look, where they seem to have moved the needle, is they recently had a look at professional soccer in Europe, and it actually showed that they had a reduction in injuries. So, when I think about where to look, certainly NFL is very well funded, and you got some very bright people there. NBA, I would agree, very, very bright people there. I would say the NBA to me seems further along than the NFL, based on what I've seen. But yeah, take a look at the Aussie rules. It's crazy what they've really got some dialed things down there. And it's more commonplace to have teams, multidisciplinary teams, and
What do you think the nature of that is? Like, because we're also, this isn't just who does best and who has the most money, but it's also a culture of innovation and how that works and moves the needle forward. I mean, it sounds like the Australian context has actually been a leading context for a few decades now. You hear good things about the All Black system in New Zealand in various ways. Or what do you think the nature? What do you think is sort of the underlying for that? If it's not just raw money, because NFL and NBA have the most money out of pretty much everybody except for the Euros and soccer, right? So I don't know. What do you? I'm just curious.
I think what I see is, Australia and New Zealand are not without their hassles and problems, that's for sure. But I feel that they are far more professionalized as far as standards of practice for sport performance practitioners. And, whereas, it's a little bit mixed in North America. I think that a lot of our strength and conditioning coaches come out of the hey, I'm a strength coach, so I'm allowed to say this. We come out of the meathead, background, it's like the
Fair enough.
school,
Sure.
how much you squat, how much you power clean. Definitely segregation between strength and conditioning, athletic therapy, and medicine. So don't tread on my turf. You do you, I'll do me, and there's a lot more of that. There's not that integration. Sure. And what I see in Australia is it's less meathead. It's more embracing research. So they've got far better funding and research happening, in my opinion, in this space. And they've got far more openness to create true multidisciplinary teams, right? Where you can have people sitting around a table and truly working together. My work with professional teams in North America is still very often comes down to, I'll be like, hey, this is amazing collecting all this data on the sport performance side. Have you thought about sitting down with the clinical people, like your athletic therapy group or your physical therapy group or whatever, or your physicians or your surgeons? And they're like, oh, no. We can't talk. We can't share our stuff with them. They get real and it could be the other way around too, where it's like the medical people are like, oh, we can't talk to we'd love the strength coaches to be working more with us, but that's not, it's not in their plans. So
it's interesting.
Yeah, I think that's a key piece. And it's these multidisciplinary teams, right? Like they're hard. It's hard to make them work because we still operate on hierarchies.
So it sounds like where you see a culture that promotes or sort of converging different disciplines converging around data together seems to increase the type of innovation that you're seeing as effective. Is that what I'm hearing?
Yeah, I mean, that's my experience. It's funny, at the end of the month here, I've got roped into my friend, Brett Bartholomew. I don't know if you guys know his name, but he's been doing a lot in the leadership area, and he's got a conference, and he's like, hey, would you do a little presentation? And I was like, what am I going to present on? And then in this paper, I showed you that the monitoring the return to sport transition, we actually talked about how our team worked, and we used the word holacracy, which is contextual leadership, kind of a flat leadership structure where depending upon the situation, different people are stepping forward. And so I chose that topic for Brett's conference. And honestly, I think that the more I think about it, it's like, that is, in my experience, how you manage these the best, is you have a multidisciplinary team. It's a flat leadership structure. So it's not one boss and a bunch of subservience, and data led. Start with the data and then tell me about what you're thinking. And too many of our conversations will go down the rabbit hole of what does everybody feel is happening, which is obviously an important data point, because we want to know what the experience of a practitioner is.
Sure, a couple senses, yeah.
But it just is in cloud. It gets so biased when you have people that get really emotionally invested in an athlete's recovery. They overlook facts, and it's like, it's amazing. You think that person was doing great and ready to rock, and they've got 40% different side to side in terms of some variable. So it's like, well, you overlooked it because it wasn't data led. So I think those are some keys.
I gotcha. Great. Thank you. Sorry, I didn't mean to take up so much time.
No, it's great.
That was awesome questions, Peter. Thanks a lot for that. So we're getting now we're not
Thanks, Matt.
We're
after 11. So I think I'm going to just shut down the recording now. But hopefully, Matt, you'll be available maybe for another 10 minutes or so, just for any informal discussion that the audience might want to engage in. And so I'm just going to thank you very much for, I just love your talks. They're so well presented and informative, and I really love the marriage of sports science and sports analytics, of course. So I really, on behalf of our group, big thank you for your presentation.
Yeah, happy to share. This is fun. Thank you.
Great. I'm just going to shut the
Excellent.
recording.